What happens inside the brain during a brain hemorrhage? When a blood vessel bursts in the brain, several harmful processes begin to happen. These changes can damage brain cells very quickly. Understanding these processes helps explain why every minute matters. The first problem is pressure inside the skull. When the blood vessel ruptures in the brain, blood begins to leak into surrounding brain tissues. This blood forms a mass called haematoma. But the brain sits inside the skull and the skull is a rigid space, so it cannot be expanded. As the hematoma grows, it begins to push against the nearby brain tissues. This pressure can stop brain cells from working properly. Depending on the area, speech, movement, or breathing can quickly be affected. The larger the bleed becomes, the more pressure builds up inside the skull. This is why a brain hemorrhage is the medical emergency. And this pressure continues to build as the bleeding grows. Another important problem is that bleeding may continue. After a brain hemorrhage starts, the bleeding may not stop immediately. During the first few hours, the pool of blood can continue to grow. As the bleed becomes larger, it creates more pressures and causes more damage to the brain. This is why getting to the hospital quickly is so important. Doctors can scan the brain to see where the bleeding is happening. They can lower blood pressure, reverse certain blood thinning medications, and closely monitor the patient. Arriving early means doctors have more options to stop the damage from getting worse. Blood itself can also damage brain cells. Blood normally stays inside blood vessels, but when bleeding occurs in the brain, blood leaks into surrounding brain tissues. Over time, red blood cells outside of the vessels begin to break down. When this happens, substances from the blood can irritate nearby brain cells. Cells that were not damaged at the start of the bleed can still become injured later. This means the damage from a brain hemorrhage can continue for hours or even days after the bleeding first begins. This is another reason why early medical treatment is so important. At the same time, the blood in the brain activates the immune system. This reaction is called inflammation. Inflammation can cause the brain to swell, and this swelling increases the pressure inside the skull even further. Because the skull cannot expand, the swelling has nowhere to go. This extra pressure can damage more brain cells and make the situation more dangerous. In some cases, swelling can be just as harmful as the bleeding itself. This is why doctors need to monitor patients closely after a brain hemorrhage. So, if you notice symptoms of stroke such as face weakness, arm weakness, or speech problem, call 999 immediately. However, not everyone shows these typical signs, so any sudden neurological symptom should be treated as an emergency. Every minute matters. Early treatment can save brain cells and improve the chances of recovery.